So my name is Chander Khatri. I'm an urgent care physician at Lowell General Hospital, Circle Health Urgent Cares. I've been with Lowell General since 2017, so about fourth year now, going at the urgent care. I am family medicine physician by training, but I've done urgent care for the last few years.
So you've been at Lowell General for how long?
Since 2017, so this is my fourth year here,
Yeah.
so 3 years completed.
And we're doing this, partly why we're doing this interview is because of COVID-19. So let's just jump right in on that. And can you tell me a little bit about what your hospital has been dealing with? Have there been a lot of cases there, or are you seeing fewer cases than in the general population?
So I work at the urgent care, so we're limited in that information. But as far as hospital is concerned, they are seeing quite a bit of patients. So they have about 70 some patients that have COVID-19 or suspected of COVID-19. Some people are in ICU, some are ventilators. So they're seeing good amount of patients. They're still, I think, embracing for the surge to happen that is expected. If this doesn't slow down any.
So does urgent care, if are you keeping patients and the staff safe? Do you have enough equipment?
So at the urgent care, what we have done is we have gone to telemedicine. So we are open and we're still seeing our patients who are not able to see their primary care doctors and or after hours. But we are have suspended the walk-in appointments. We're doing telemedicine and video conferencing to facilitate social distancing. And we have enhanced our check-in process to make it easier for patients to make appointment either online or via phone. We are having individual visits without any visitors, but unless the patient is a minor or they have some disability. But we are treating all different kinds of non-emergent conditions still, from injuries to illnesses. But our process of how we get the patients in or see the patients has changed slightly.
And that process, can you explain it a little bit?
So we have suspended the walk-in appointments. We're encouraging patients to give us a call, and some people who are don't get to that point but walk in. We have the individual. We have a staff sitting outside right by the door where we are directing patients to get their information, have them go back to their car, and then what happens is that patients get phone call and they get registered on the phone, and then the nurse triages them on the phone, and the provider then does the visit with them via teleconference. And if we need, then we can do a video conference as well. And we treat them that way. And if they need any kind of medication, we can certainly prescribe any medications that is non-narcotic via telemedicine.
So does what you're doing fall under the category of telemedicine?
Yes, it does at this point.
And
we're
say that again.
Go ahead.
I was just going to ask, if you could just specifically speak to what that is.
So telemedicine is a visit via teleconference or video conference, either on the phone, iPad, laptop, or whatever is available. But mostly it's done through the phone, and we can talk to the patient on the phone and get the details and treat them as needed. And now, if we think that patient needs to come into the clinic because there's something specific we cannot do either with the video or on the phone, then we have them come into the clinic. But we do screen them for COVID. So trying to keep the social distancing, not exposing our staff, and keeping the patients safe as well.
When should people call the hospital? When, at what point are they sick enough to make that phone call?
So the symptoms that patients can get is like low-grade fever, sore throat, achy feeling, headaches, cough, and shortness of breath. So if you're concerned with and you have these symptoms, then you can call your primary care doctor first, or you can call us, and we can discuss this on the phone and determine if you need to stay at home or go to the ER. Now, if the person is very sick and they're feeling really short of breath, cannot contain their cough, or they have persistent headache that doesn't want to go away, or high fevers, then you can certainly head to the ER. But even then, you want to call the ER and say, okay, I have these symptoms and I'm either sitting out in the parking lot in my car or I'm at home. Should I come to you guys or not? So keeping that social distance is very important. You may not have COVID. You might have like just a cold or something that you don't need to go see somewhere and get exposed by COVID.
Yeah, that was my next question. It's allergy season, and I know I'm sneezing, and I know it's not due to COVID. But how do
Yeah.
you, as a surgeon, a physician, differentiate?
So it's going to be difficult to differentiate. We won't know. I mean, there are certain things that come with infection and some things that come with allergies. So sometimes it's a very gray zone. We don't know which is what. But then all depends on the history and how they feel and what they tell us and what we ask. And maybe we might need a video conference with the patient to decide, do they look, because sometimes they cannot explain. We just have to look at the patient. And that might tell us like, okay, we can see that patient is stable. They seem to be okay. So we're thinking that they're going to be okay at home and we can maintain this. And we give them guidelines as to when to call again or go to the ER or talk to the ER if they're getting worse. And you're right, it's going to be very hard to determine. But there are certain things that kind of tell us like, do we have infection that's bad enough? Or we have symptoms that are bad enough to require more than just kind of monitoring and over the counter medications at home.
So telemedicine has been around for, the concept has been around for a long time, but it seems like, is it COVID that sort of launched it into our public awareness?
Yes, so the COVID has brought the telemedicine out in the front everywhere right now. I mean, we still cannot ignore our patients. Patients are going to get sick with other things like urinary tract infections. They have cough that's not COVID, but they have asthma problems, stomach problems. They might have lacerations that require treatment or some other injuries that require treatment or monitoring. So yes, telemedicine has been around for a long time, but COVID has brought it up front where we normally would have seen everybody that is wanting to come in and see us. Here we're kind of limiting who can come in. And we have come up with telemedicine where we normally would not have done the telemedicine in the clinic. Now we are forced to do it because we still have to take care of our patients and prescribe medications as needed. And very few individuals who we can determine over the phone or the video that they should really be seen in the clinic, we have them come in still.
I remember a nurse once told me that she always looks at the fingernails of the patient, and that's one thing you can't do.
Right. So there are many things that cannot be. So now we really determine if the patient can wait or do we need to treat them now. So, or they need to be seen now versus you can wait. So just like the surgeries, as you hear, that elective surgeries are postponed. Only emergency surgeries are being done right now. So same way we can think about every ailment that people have. Like, can we just kind of maintain with conservative measures or maybe over-the-counter medications or prescriptions that we can send for the patient versus they have to be seen in the clinic. So the main thing with COVID is really the social distancing. We really have to maintain that, not for ourselves, but for other people in general. And other people's health will determine your health in this case.
Yeah, it's a very interesting time of living.
Yes.
Do you have any COVID patients in uh, the special care unit?
So the hospitals have them. Lowell General has COVID patients in the hospital. As an urgent care physician, I don't see those patients, but we do. I have talked to two patients who were either exposed to COVID and they have symptoms, or they have been tested positive for COVID, but they were safe enough to be sent home. And we just did the checkup on them as a follow-up. So yesterday I was talking to the patient and their family at home, who has tested positive and they're having symptoms, but thankfully that person is actually improving and feeling better at home and did not
That's
need to be hospitalized. But she's
that's good
COVID
to,
positive.
yeah, that's good to know. So, are you aware of any deaths in the hospital from COVID?
I'm not aware of deaths in the hospital. No.
Good, good to know. So what if someone just needs blood work or a diagnostic test like an X-ray? What would you should they come in? Should they put it
So
off?
depending on their symptoms, yeah. So depending on their symptoms, if they are stable, then the blood work or the X-rays will not change any treatment unless we determine that doing that test will change the treatment for the patient or the outcome of the patient. Then we will have them come in after we screen them for COVID questionnaire, where
Mm.
we can either have to gown and put our PPE on that we have available right now, and the patient also will have to be have some mask on at least to come in and get that done. If the patient is stable and we can treat it just by telemedicine conferencing call, then we won't have them come in. If they are concerned that they might have COVID and they want to get tested for it, we don't do testing at the urgent care, but they should call their primary care doctor who can give them order, and they will be made an appointment for drive-through testing at the Lowell General Hospital main campus.
Oh, that's great. Drive-through testing.
Yeah, absolutely. Yeah.
We the world is changing.
World has changed quite a bit, absolutely. But we are learning more and more about the virus, and we're going with what is happening in the epicenters of it. And Massachusetts has lots of cases, and not as much as New York, for example. But
Right.
all
Thank
these
God.
all these countries, states are, and patients, we're learning more and more about this.
Mhm.
So there's no exact way to tell somebody has COVID or not just by looking at them. But at this point, social distancing is the really thing to do and stay at home as much as possible if you're able to. So keep yourself from getting infected or infecting others. As some individuals who have the infection are not presented with any symptoms, so they don't even know that they have it, but they can pass it on to somebody who might get bad reaction from it or get really bad illness, end up at the hospital and ICU from it. So
Would
social
the
distancing is really required.
would the test show that they are a carrier but not
So it
sick
depends
from
on the
it?
test. So it's there different tests are coming up, but sometimes you will have false positive or false negative of the test. So depending on the acuity of the test, the test will show if you have the infection. In most of the cases, they're finding the current test anyways. So even if you don't have the symptoms, you can get tested and know it. But the testing is limited. That's the other part. The testing, we don't have tests for everybody
Mhm.
to test for. So if you really are struggling with symptoms, then, or if you have come in contact with somebody you know and you want are concerned, you need to call your primary care doctor and they can determine if you should get tested or stay at home.
When you're in medical school, do do they teach you that, about a pandemic and the possibility of that happening?
They talk about it like the pandemics that have happened in the past, you know about it, but there's no way to prepare for it. Everything is different. Even
Yeah.
the people who have gone through past pandemics who are still in practice right now, they can siren some alarms about what could be happening, but it's hard to know until it hits you. So um, yes, we talk about it, so to speak, but it's hard to prepare for something like this. And COVID has hit pretty hard all over the world really fast.
Yes, it has. Let's get philosophical for just a minute.
Sure,
And this is just, I mean, I would ask you this whether you were a physician or not, but I think
sure.
you being a physician, you have a better, understanding of how the world is changing. Do you
Yeah.
think that we will ever get back to the way we lived before? We were rather naive. If I dropped a piece of chocolate on the floor, it was chocolate. I was going to eat it anyway. And now I don't think I would do that.
So, world is gonna get back to normal as
Mhm.
it always has. We just need to be careful. So there will be for a while. I think we're going to be a little bit more careful about things. I hope, And that's what we need to do. We don't shouldn't be so careless, and we have to be on the lookout for ourselves and the individuals around us and the loved ones that might be more sick than normal. And people who have experience with having individuals at home that their loved ones are immunocompromised. I've had patients tell me, like, I am getting sick. I don't know what it is. I take care of my elderly mother or father who's immunocompromised. What should I do or should not do? So that kind of mentality, I think, would should be generalized more in everybody who either has experience or doesn't have experience. Well, if you think about it, now COVID has brought this um, mentality to everybody because everybody is having to follow and adhere to the social distancing and care for that. Make sure you wash your hands and that. So I think we will get back to mostly normal life, except for we probably, as we should be, a little bit more careful. I think we're going to be not completely back to how we were before COVID, though.
Yeah. When do you think that do you have a timeline in your head as to when it might be better, get better for us?
I keep thinking that maybe May, June, we might be able to see where what we have done so far has made a difference of cases going down. Now, we cannot be naive and say that the cases will be gone by June, July, and then after that, we have no COVID at all. We will still have COVID. It just won't be as bad. Hopefully, by then, we'll have medicine for COVID. We'll have vaccine that works for COVID, that is in the works at least. It takes a while for the vaccine to develop and get to the general population that yes, we have a vaccine for anybody to use and get shots of this thing just like flu shot. But my hope is that by the summertime, we will be at the level where we're seeing the results of what we have done so far and then starting to get back to a little bit of more normalization. And we're able to not be as afraid to go out and we lift some of the restrictions that people have, but you still have to maintain your social distancing as much as possible. Wash your hands, make sure you're sanitizing your hands, and being careful. That will still be there. So it's not going to be gone, but definitely we'll hopefully have a better handle on this. Rather than increasing the number of cases, we'll have less of an acceleration in the cases and decelerating.
You just answered my last question, but
Mhm.
I just ask, in terms of not cleanliness, but in terms of getting rid of the virus in the household,
Yeah.
any recommendations on how to go about doing that?
Make sure you're wiping your surfaces with cleaners, and then washing your hands as much as possible. And washing hands can get them dry, so make sure you're sanitizing and then using lotion for your hands to moisturize them. But again, social distance is one thing. If you're going to go out, make sure you have a mask on if you're able to. If not, then go ahead and make a mask for yourself and go outside. Be as little as possible. Even in the store, stay out of um, keep the distance of 6 feet
Mhm.
from the other individual, especially if you're having symptoms of cough that we don't know about what they might have. But at home, just make sure you're keeping the surfaces clean at all times and washing your hands. Laundry is on timely manner as well.
Well, thank you, Doctor. Is there anything else you'd like residents to know in the general Lowell area?
So I like them to know that the COVID-19 is here and we have it. It's hitting us hard, but we are better off because we do have social distancing in place that I think is working in some capacity, starting to work. We will see the result of it. Just stay put. Do not get too anxious about this and do not worry too much about it. Just be careful as you would in any kind of situation which requires it, and then we will get back to normal self, hopefully soon rather than later.
Thank you so much for this time.
Thank
Um,
you for having me.
this is Joyce Polino Crane for Westford CAT. See you around town. Thank you. Thank you, Doctor.
Thank you.